friends, hope you all are fine. Today I'll talk on hemoptysis. What is hemoptysis? It is coughing out of blood. But in our society or many health workers believe that any person or any patient coughs out blood, that means that person is having tuberculosis. That's a total wrong idea. Today I'll talk on that and I'll clear all your confusions whether having hemoptysis means having tuberculosis and what are the signs of tuberculosis. So let's start this. First of all, I'll tell you the symptoms of tuberculosis so that you can understand the topic very clearly. If a patient is having cough for more than 2 to 3 weeks, patient is having fever or in rise of temperature, patient can have breathing difficulty, chest pain, loss of appetite, loss of weight, etc. And patient can have hemoptysis also. Means patient can have this coughing out of blood. These symptoms patient can have. So these are symptoms of tuberculosis. But what happens is, I have seen many health workers or many doctors also. Any patient coming with hemoptysis, they tell the patient that you are having tuberculosis, and sometimes patient is put on antitubercular treatment, which is again some strong antibiotics patient is exposed to. So it should be clear to us that any patient coming with all these symptoms, whether we'll put on antitubercular treatment or not. If patient is having all these type of symptoms, then we can suspect tuberculosis and we can ask for some investigation, like we can ask for sputum smear for acid-fast bacilli, and we can do a chest X-ray, very simple 2 tests, and by these 2 tests we can diagnose tuberculosis. Most of the tuberculosis we can diagnose by this. So any patient having these symptoms, we will do 2 investigation. Now, after the investigation comes, if the patient sputum is positive for tuberculosis bacilli, then we are sure that this patient is having tuberculosis, and straight away we put the patient on treatment. Now, if the sputum is negative, then what? Then we will see the X-ray and we will judge whether this patient is having tuberculosis. By the clinical expertise, clinical experience, we can diagnose tuberculosis, even sputum negative tuberculosis, and put the patient on treatment. So that's all about tuberculosis and its symptoms. Now, if a patient had tuberculosis in the past, like if the patient had tuberculosis maybe 15-20 years back, maybe 5 years back or 1 year back, or whatever, like in the past he had tuberculosis and he was treated for tuberculosis with proper treatment, whether in government setup or private setup. Now the patient is coming in outpatient department with hemoptysis, with these symptoms. Now we'll ask the history. We'll ask the patient, okay, whether you are having cough for more than 2 to 3 weeks, whether you are having loss of appetite, whether you are having fever. We'll inquire all the symptoms of tuberculosis, just to detect whether this patient is having active tuberculosis or not. So history taking is very important. We ask the patient for the history, whether any type of complaints, any type of problems you are having. See, sometimes patient or patient family members, they are reluctant to give the history. They sometimes don't want to tell whether the patient was having TB, he had TB in the past, because there is some social taboo. They sometimes think, oh, why you should tell this thing, but actually you should tell the doctor whether the patient had TB, because this will help us in diagnosis, and this is for your good. If you tell the history properly, then we can diagnose properly and your patient will be put on accurate treatment, Now, after taking history, we'll understand that whether this patient is having any problem at present or whether this patient is having problem related to some other disease in the chest. So after taking the history, we'll ask for this 2 investigation. If the patient tells that I had tuberculosis in the past, so we assume that your tuberculosis in the past was cured properly, completely cured, and you have completed the treatment. So the possibility of again getting tuberculosis is low. Now we ask the patient to do two investigations. One is sputum smear for pars bacilli, tuberculosis bacilli, and another is chest X-ray. Now, if the sputum is positive, again, patient had treatment in the past, okay. Now, again the sputum is positive. That means the patient is having relapse of tuberculosis. Means he had tuberculosis in the past. Now he is again, reactivation of the disease in his body. So this is relapse, and we will put the patient on treatment again. The treatment will depend on the, we have some rules and regulations, we have some guidelines. According to that, we will put the patient on treatment. Okay. If the sputum is negative, then we will see the X-ray. In the chest X-ray, we will see for cavity, nodules, or fibrosis, and we will judge whether this patient is having active tuberculosis or it is treated tuberculosis. There is difference. By seeing the X-ray, if there is any opacity in the X-ray, that doesn't mean the patient is having tuberculosis. That opacity is what type of opacity it is, whether it is a wet type of, whether it is an active type of opacity. That depends on your clinical judgment, our clinical judgment, and our expertise. We can understand that that opacity is active or not. So depending on that, we decide that this patient is not having tuberculosis or having tuberculosis. If the patient is not having tuberculosis but still having hemoptysis, then we give the patient some symptomatic treatments to reduce the hemoptysis, so that the patient coughing out of blood stops. But we don't put that patient on anti-tubercular treatment. So I think by this time it is clear to you that any patient with hemoptysis should not be put on anti-tubercular treatment. We have to judge whether this is active TB or this is a treated tuberculosis. So that's all, friends. I wanted to explain you about the condition called hemoptysis, which occurs in tuberculosis and which also occurs in some other diseases, and in treated tuberculosis patient who was already treated for tuberculosis. So there are multiple conditions where hemoptysis occur, that I'll discuss in some other video. But for today, that's all. Thank you for watching this video. Hope you stay healthy.